Hi, I'm Shelley Gregory. I use they, them, theirs pronouns, and I'm the strategic project coordinator at an organization called Forge, which is a national transgender rights organization that's headquartered in Milwaukee. I've been asked to talk to you a little bit today about the work that I do, about my career path, and then about some issues relevant to transgender and non-binary individuals. And I'll do that specifically talking about issues affecting our community in Wisconsin. And before we leave today, I will share some resources with you, additional resources and additional learning opportunities for you. So before we get into the substance of the presentation, I'll just share a little bit about myself. I'm a 1997 graduate of Carroll, and for those of you like me who don't do quick math, that's 24 years ago. So I was at Carroll back when Carroll was a college and not a university. I came to Carroll from the North Woods of Wisconsin in Minocqua, and I ended up being an English and a communication major at Carroll. And I then left Carroll and went to law school and eventually found my way to San Francisco, where I practiced for about 15 years as a civil rights attorney. After that, in about 2015, I came back to Wisconsin. And at that time, I decided that I wanted to use the knowledge and the experience that I had to help people with, some challenges and obtaining access to institutions and resources and services a little closer to the ground. So I began working at the Milwaukee LGBT Community Center in a new position they'd created in 2016 to specifically serve the transgender community in Milwaukee and Wisconsin. And I did that work for about 2 years and then shifted over to Forge. So I'm really happy to be at Forge. We're an organization that works on 2 tracks, both nationally and then within the state of Wisconsin. At the national level, our work is primarily focused on anti-violence work on behalf of transgender individuals. The way we do our work nationally is to provide services like consultation, training, and other kinds of technical assistance to service professionals who are working with transgender individuals who've experienced violence or who have other trauma experiences. So that means that we do a lot of going into organizations, consulting them on their policies and their practices, and then offering really in-depth kind of personalized trainings to help those organizations get where they want to be in terms of their competency for working with trans individuals. In Wisconsin, we do similar work. I work primarily in Wisconsin, so I have the opportunity to go out and work with local medical providers, mental health providers, other service professionals, first responders, and again, do the same thing, offer training and offer consultation and behind the scenes assistance to help them do what they need to do to better serve trans and non-binary individuals. The other work that I do at a statewide and at a local level is to provide direct support to individuals. There are many reasons that a lot of transgender people have difficulty accessing needed resources, whether it is culturally competent medical care, mental health care. Folks may need some advocacy in dealing with insurance companies that are bulking at providing coverage for gender affirming care, those sorts of things. So I provide those kind of direct services. We provide technical assistance and training. We have a lot of publications online, both for individuals and service providers. And during COVID, we've moved our group services online, and we have group services online via Zoom a couple of times a month. At the end of the presentation, I'll give you our websites where you can find more information about all of those services if you're interested in accessing them. So before we kind of delve into talking about some of the issues that transgender folks are dealing with in Wisconsin, I want to just briefly review some really core concepts about identity. And I suspect that you've probably talked about some of these concepts already. I'd like to start over on the, if we were looking at this as a clock face, at the 9 o'clock position at gender identity. I've used the term gender identity a few times. And again, I just want to reiterate that gender identity, and in fact, all of the overlapping circles present on this little diagram are aspects of identity that every single one of us carries with us. Whether we think about it or not, we all have an aspect of us represented by each of these 4 overlapping circles. When we talk about gender identity, what we are talking about again is somebody's deeply felt innate sense of what their gender is. And what the answer to what somebody's gender is can vary really widely, right? We think about gender and science and medical science and psychology are teaching us and have taught us that all of these elements of our identity are really best represented by a spectrum rather than, say, a two-sided coin. So when we talk about gender identity and what somebody feels their gender identity is, there's a wide variety of possibilities. We can think of one end of the spectrum as male or masculinity. We can think of another end of the spectrum as femaleness, womanness, femininity. But that spectrum is broad. There's a lot of stopping points in between. And there are people who identify in ways that aren't even represented on that spectrum. So, there are folks who might feel more masculine, might feel more feminine, might feel somewhere in between. They might feel like they're off that spectrum altogether, and that they don't really have a strong gendered sense of themselves. There are people who feel like they might move around on that spectrum, or that multiple points on that spectrum kind of resonate with them. So again, the point is that we all have a gender identity. And it can vary. It can vary on a spectrum, and it can even be off of that spectrum. Same deal moving straight across the diagram to the green circle on the left at the 3 o'clock position. Gender expression is a term that you may have heard. Gender expression is really kind of intuitive. It's just the concept of, that each of us expresses gender in some way. So we may express our gender in ways that are more kind of traditionally masculine, traditionally feminine, somewhere in between, and again, maybe somewhere totally off of that spectrum. But what we're talking about here is the way we dress, the way we might cut our hair, makeup that we may or may not use, and how we might ask other people to relate to us in terms of the name we use or pronouns that we use. So gender identity and gender expression are somewhat related. Gender identity being our internal sense of who we are, and gender expression being what we project out into the world at any given point in time. I'm going to go right to the bottom of the chart, the purple circle, at what would be the 6 o'clock position, and talk about sex assigned at birth. Sex assigned at birth, again, is sort of intuitive in its description. When we are born, a birth certificate is generated, and in the state of Wisconsin, like many states, there's only 2 options available on that birth certificate, male or female. Now, how do we know what somebody's gender is or what somebody's sex is when they're born? Well, we don't really. Medical providers obviously examine external genitalia, and given the options that are available, are required to place a newborn in the category of male or female. This is being done simply based on an observation of external genitalia. So rather than talking about somebody's birth sex or biological sex or natal sex, what we're doing is using a term that really describes what's happening. A sex categorization is being assigned to a newborn at the time of their birth based on an observation of their external genitalia. And that's the little marker that ends up on our birth certificate, male or female. I'm sure you know that there are people who have many different conditions that get grouped under the term intersex. Many states in the United States are starting to think about providing additional categories in addition to male and female on birth certificates and on other identifying documents to make room for the fact that not everybody's body looks like what we traditionally associate with male or female in terms of these categories assigned at birth. There are other countries that are ahead of the United States on this. Wisconsin still operates in all of its sex and gender categories in a very binary way, so that someone is required to identify either with male or female, M or F. Up at the top of the chart, sexual orientation. I'm just going to touch on this briefly. Our sexual orientation is our sense of who we are, that we feel attracted to and connected to. And that could be, emotional connection, romantic connection, sexual connection. And again, that's something that we feel on the inside. It is not dictated by anything else on this chart. It's not dictated by our sex assigned at birth. It's not dictated by our gender identity. These are all overlapping categories, independent categories. And, we are in the middle of this with all of these overlapping elements of our identity. So when I talk today about gender identity, gender expression, this is what I'm talking about. This is just another graphic I'll put up for a second. This is a graphic created by an organization called the Trans Student Educational Resources. And they've developed something called the gender unicorn as another way of talking about the concepts we were just talking about. So again, starting over on the left side, gender identity, they're sort of depicting this as being our thought process inside our head, our understanding of who we are internally. Gender expression is kind of the aura of who we are, how we express our gender in the world. Over on the right side, it's sexual and romantic orientation, what we feel on the inside about who we're attracted to. And I don't know how much I like this, but the chart points to the external genitalia area as a way of referencing our sex assigned at birth. So these are just some visual aids to help us think about some of these concepts. The other concept I want to touch on really briefly is a word that we hear a lot about. So transition or transitioning in the context of gender. We're talking about a really broad concept when we talk about transition. And I just want to note a few really important things. First, whether somebody decides to transition, how they decide to do that, when they decide to do that, is a really, really individualized inquiry and process. There is no right or wrong way to transition. Transitioning is not required to make somebody or to allow somebody to identify as transgender. My second bullet point here is that many people don't transition in any way whatsoever. And there are lots of reasons for that. There can be social pressure from one's family not to change one's appearance. There are financial barriers to doing a lot of transitioning, whether it's undergoing gender affirming medical care, or whether it's having the financial resources to do things like go to court and change our identity documents. So there are a lot of people that don't transition in any way at all. And sometimes that's because they just don't want to. I'll use myself as an example. I was assigned female at birth. My parents raised me as a girl. I always knew that didn't feel right. I didn't feel comfortable in my body. I didn't like my chest. I didn't like my external genitalia. It did not feel like home to me. In a lot of ways, it still doesn't. There are medical transitioning. There's gender affirming care that I could undergo to transition medically. I choose not to do that for a lot of personal reasons. I don't, for instance, use hormone therapies that would do things like change the fat and the muscle distribution in my body to give me an appearance that's a little more traditionally male. I choose not to do that. I have had some surgery to change my body in a way that makes me feel more comfortable and makes me feel like I can express my gender in a way that resonates more closely to me. But I've not changed my legal documents. My birth name is Shelley, and I continue to use that. So, I've just touched on some of the ways that people transition, and I've given you a little taste of some of the ways that I have and haven't transitioned. Starting at the bottom of the list, we've touched a little bit on legal transitioning. So changing one's identity documents to either reflect a change in name or a change in gender marker. There's medical transitioning. This most often happens in the context of using hormone therapies that are either for the most part, estrogen-based or testosterone-based to change the hormonal balance in the body and to bring about some changes to the body that might make somebody feel like their body aligns a little more closely with their gender identity. Social transitioning. This is the kind of thing that can be done without medical or legal intervention. And it's the thing that is most done for really young kids who are expressing that their gender identity is different from that which is traditionally associated with their sex assigned at birth. Social transitioning includes things like, what name does someone want to use? What pronouns does someone want to be addressed with? How does somebody want to wear their hair? What kind of gendered clothing do they want to wear or not? So this is the way that we present ourselves and interact in the world with those around us. So that's a little taste of some of the elements of transitioning. And again, the takeaways here are there's going to be a lot of different ways that people do this or not for lots of different reasons. So shifting to just a brief discussion of some of the issues relevant to trans folks in Wisconsin presently, one of the things we're always challenged with the LGBTQ plus community and other kind of underrepresented or marginalized communities is getting a sense of how many of us there are in the population. So there are lots of different methods, lots of different estimates, both of the LGBTQ plus population, as well as the transgender or transgender and non-binary population. One of the better estimates we have for transgender people is a 1%. Statistic. So looking at the total population of Wisconsin, we tend to think that there's somewhere between 50 and 60,000 people in the state of Wisconsin who may have a transgender identity. And again, being transgender really means, if we think back to our overlapping circles, simply that our gender identity, so how we feel about ourselves on the inside, doesn't necessarily align with the traditional expectations that others may have for us based on our sex assigned at birth. And we can use words like trans men to describe individuals who identify as male but were assigned a female sex at birth. Or we can use words like trans women to talk about women who, again, have an innate sense that they are women or female, but were assigned male at birth. There is a term that is getting used more and more, non-binary, meaning people who don't identify with one of those two binary options of male or female. And that again can be because, you know, they identify with both, or they identify with neither, or they identify with some aspects of both. And so when we talk about a transgender identity, that's who we're talking about, this really large category of people whose gender identity doesn't necessarily align with the expectations we've had traditionally for the sex they were assigned at birth. And so again, we think this is, you know, as many as 60,000 people, and these statistics presumably undercount. And so it's likely that there are many more people. So just some quick information about transgender people in Wisconsin. Forge conducted a needs assessment, or essentially a survey, in 2019, and we've done an initial data release from that survey. We've not released all of that data, and that will still be forthcoming on our website, hopefully soon. But this is a breakdown of who we were able to survey. The largest group of respondents in our survey was 60% essentially trans or non-binary individuals. And we'll look at just one data set from the trans and non-binary respondents. And this was just a ranking. This question asked them to rank what their top areas of concern are personally as a transgender or a non-binary person living in Wisconsin. I'll let you look at this chart, which ranks the top 6 responses that we got, starting left to right, with access to healthcare, losing my rights, workplace discrimination, schools, stigma, and street violence. These categories are pretty self-explanatory. I'll just elaborate on each of them a little bit and some of the issues that they represent. As I touched on earlier, access to healthcare is a real challenge for trans individuals and communities. There are a lot of reasons that we have pretty significant disparities in terms of outcomes for the health and well-being of transgender individuals. Some of that is a function of what we call social determinants of health. So social and environmental factors that can lead to less positive health outcomes, or that can create barriers to accessing healthcare. Some of the barriers that we deal with, as I mentioned earlier, are providers who may not have sufficient knowledge to provide healthcare to a transgender individual, providers who may not be culturally knowledgeable, may not create an environment where transgender individuals feel as though they can comfortably access healthcare. These are major deterrents to transgender people accessing healthcare. One of the other issues that we have, again, is health insurance providers. There's a lot of gatekeeping that is done by insurance providers that in many cases simply want to deny coverage for any gender affirming medical care for transgender people, even though we have state and federal law that says that that's not acceptable. This is a major policy area that folks work in, and there's a lot of work done on the ground with providers, with insurance companies, and with transgender individuals within the community to try to better connect transgender individuals to knowledgeable providers. But we can see that access to healthcare is the #1 concern in our community. Losing my rights, again, I've just touched on some of that. The legal landscape for the civil rights of transgender individuals is a really complex web, both federally and at a state level, primarily because our rights vary significantly from state to state. Looking right next door at losing my rights, we have concerns about workplace discrimination. Some of you may be aware that the United States Supreme Court issued a really significant case decision last summer in which it said that our workplace discrimination laws apply to transgender people and to gay and lesbian people, so that our workplace discrimination laws apply equally based on gender identity discrimination and sexual orientation discrimination. This is going to open up a lot more protection for all LGBTQ plus people in workplaces, and should carry over to the context of healthcare, housing discrimination, other areas like that. Schools, again, are a major concern, coming in at 57%. Many of us as youth and many current youth encounter high levels of bullying, stigma from their classmates, and unfortunately, sometimes encounter non-inclusive treatment in their schools. So teachers, faculty members, administrators who don't understand some of their needs, who may not have inclusive policies and practices in place, who may not be in a place where they are willing to, for instance, refer to a student by a different name or a different pronoun. Stigma, I think, again, speaks for itself. There is a lot of institutional cultural bias around gender identities that are not traditionally associated with the sex that we may be assigned at birth. And that stigma and that bias that is present underlies a lot of the other challenges that our survey respondents are indicating are areas of concern for them. Street violence, again, many of us are aware. I've talked a little bit about some of the anti-violence work that Forge does. What we are seeing in mainstream media increasingly are the most horrific aspects of violence towards the trans community. And we see reports on a much too frequent basis of homicides occurring of trans people, often trans women, and often trans women of color, who are some of the most vulnerable members of our community. So, that reality is obviously present in the mind of many transgender community members, and is one of the top areas of concern in our community. So this is just a really, really, really fast, brief overview of what transgender people in Wisconsin say are their greatest areas of concern right now. This is just a photo of downtown Milwaukee taken last summer. Our Pride celebration was canceled because of COVID in the summer of 2020, but community leaders, Black community leaders in the LGBT community were able to pull together a really amazing march in support of Black Lives Matter from our LGBTQ community. I was really excited that I was able to be there, and we ended up with about 3,000 people marching through the city of Milwaukee in support of Black Lives Matter from our community. So before I turn to some resources and we close this conversation, I just want to touch again on the concept of building and creating inclusive, supporting environments for everybody. And the perspective I'm taking on this as I chat with you today is less about focusing on the very individual needs of people from communities that we may not be a part of, and may not have a full understanding of, but instead thinking about the environment and the culture that we're a part of and that we're a part of creating, and thinking about how we do that in ways that are just really more open, more welcoming, more inclusive. And what that really comes down to is just treating people as individuals. So, these are some of the suggestions that I've taken from a publication called The Beginner's Guide to Being an Ally to Trans People, and the site is there at the bottom. One of the first recommendations is that we engage with and we listen to people as individuals. And I know that these may sound really obvious, but if we think critically about how we engage with people, are we bringing our own assumptions and presumptions to a conversation? Or are we sitting back and saying, hey, tell me about yourself? Tell me what your concerns are. Tell me what your needs are. Tell me what I can do for you as an individual. So we want to always engage with people as individuals, recognizing that we are operating in all kinds of systems and systems of power and oppression. But the person sitting in front of us is always an individual with individual needs and individual concerns. Number two, making an effort to use somebody's correct name and pronoun. We hear lots and lots of talk about name and pronouns these days, and we know that sometimes, the idea of trying to figure out and remember somebody's pronoun or concerns about using the wrong pronouns are really prevalent in the forefront of our minds. What I'd like to say about that is, we all have a name and we all have a pronoun. And our job is to just know and use somebody's name and know and use their pronoun, regardless of their gender identity. How do we find out what somebody's name is? Do we guess? No, we ask. Well, same deal with pronouns, right? When we ask somebody's name, we can ask their pronoun. When we introduce ourselves, we can model use of pronouns. When I introduce myself, as I did at the beginning of this presentation, I said I'm Shelley. I use they, them pronouns. Well, that then prompts somebody else to know that it's an okay and safe environment for them to share their name and pronouns. So hearing what those pronouns are, remembering them, using them, that's our job. And guess what? If we forget, if we make a mistake, we do the same thing we do when we've forgotten or made a mistake about somebody's name. Geez, I'm sorry. Thanks for letting me know. And we use the right pronoun going forward. Number three, using gender inclusive language. What does this mean? What it really means is thinking about how we talk and how gendered our language is on a regular basis, and trying to train ourselves to move away from using gendered language. So saying things like, good morning, sir. Good morning, ma'am. How can I help you, sir? How can I help you, ma'am? Well, what message does that send to people about two issues? One, that there are two sort of options for gender that are valid, the masculine and the female. And if we don't fit into that, we are other, we're excluded. And two, what happens then when we get that wrong? Right now, we've started off our conversation and our interaction on the wrong foot. I had a police officer ask me during a training. I like to be polite. And so when somebody rolls down that window during a traffic stop, the first thing I say is, hello, sir, hello, ma'am. Well, what's better language that I can use? And the conversation I invited was, how do we convey politeness? We do that in lots of ways, with our tone, with our body language. What happens if we just stop using the words sir and ma'am and say, good afternoon, how are you? I need to see your identification, please. So, I invite you to think, even for the next day, the next 24 hours, listen to yourself talk and think about how gendered the language is that you use and where there are places that you can simply remove that language. You may not even have to think about replacement language. These are things that, again, while they may seem minor, send a really strong message to people like me who are accustomed to feeling outside of a lot of interactions and a lot of conversations and a lot of systems simply because of the language that's being used. Number four, my shorthand here is curb your curiosity. Okay, so what this means is that in our interactions, in the professional work that we do, let's think about the questions that we're asking people. I don't need to know what somebody's body looks like under their clothes. I don't need to know what kind of medical care they're receiving. I don't need to know what kind of surgery they've had to do many, many things for them. I just don't need that information. I don't need to know a lot of the times, unless it's relevant legally, I don't need to know what their birth name was. These are areas where asking questions that are extraneous and irrelevant, again, not only can be just sort of stigmatizing and traumatic for somebody on the receiving end, but really are unnecessary. So again, in our interactions with folks, I invite you to think about the kinds of questions you're asking, the kinds of issues that you're raising, the things that you're discussing, and think about, are they really necessary? Is what I'm saying really relevant to the conversation that we're having or the information that I need to get from somebody to help them? Number 5, show up however you're able. That may sound like a little bit of a caveat given that I've just shared some prescriptive things that we can all do, but the reality is trans people are people. LGBTQ plus people are people. We are all people. We show up every day. We do the best we can. Sometimes we make mistakes. Conveying sincerity and genuine care and concern for somebody goes a long way. Nobody has to be perfect. In the ways that you're able to show up and be present and be inclusive and being supportive, whether that is using somebody's correct pronoun, whether that's getting on the phone and calling legislators to advocate for different policies that are more supportive of trans people, whether that's speaking up at school when you hear a transphobic joke, whatever those ways are that you can contribute to making a more inclusive society are valued. And I'd ask you to think about doing them and doing them the best you can every day. Just a quick example of what we were talking about. Some things like using non-gendered language, using right names and pronouns can seem really minor. We have more and more and more social science research and data that tell us that these things, while they seem minor, have a really significant effect on the mental health and the health and well-being of transgender people. So simple things like using a chosen name, using pronouns, can reduce depression dramatically, reduces thoughts of suicide dramatically, and in fact reduces suicide attempts dramatically. So this is the kind of effect that small changes in our behavior can have. I'm just going to wrap up by sharing a few resources and additional learning opportunities. These are some organizations. They all have websites, Facebook pages. If you're interested in learning more about gender issues, Gender Spectrum has a great website for everybody to learn more about gender identity. They've got resources for educators, parents, family members, friends, trans people themselves. Same deal with trans student educational resources. They've got the cool gender unicorn pictograph we looked at earlier. They have lots of really cool one sheet kind of visual aids. BTAC over on the right, that's the Black Trans Advocacy Coalition. This is a group that uplifts Black trans people and brings a lot of awareness and greater understanding to the issues facing Black trans people in our society. The National Center for Transgender Equality is a great information resource and advocacy and policy resource. I know that a lot of you are perhaps looking at healthcare professions or mental health professions. These are some medical and mental health organizations that do a really, really good job understanding and explaining trans issues in healthcare and working with trans folks. The Center of Excellence for Transgender Health is a project of the University of California at San Francisco. They have lay information. They have information all the way up to actual standards of care for providing medical care to transgender people. Below that, the Fenway Institute has awesome medical educational resources. GLIMA is, I believe, the Gay and Lesbian Medical Association. That's a a membership organization for people providing healthcare to LGBTQ plus communities. And finally, the American Psychological Association has just done a ton of really good work around mental health care for LGBTQ people, around social determinants of mental health outcomes. And they have really, really excellent informational and advocacy materials there. If you're looking for something like explaining why conversion efforts, so the idea, the really debunked idea that we can use a therapeutic process to change somebody's gender identity or sexual orientation, the APA has really awesome resources for education and advocacy on those kinds of issues. And then finally, these are just some organizations that do really great legal work and policy advocacy on behalf of transgender folks: the Transgender Law Center, Transgender Legal Defense and Education Fund, the National Center for Lesbian Rights, which retains a name that it's had for a really long time, has actually been a really serious leader on transgender legal issues. And then, of course, Lambda Legal, which is an LGBTQ plus organization that's been around for many, many years. So I will stop talking. I will leave you with my contact information. If there's anything I can do for any of you, if you know folks who need support, if you know individuals or institutions who are looking for institutional support, whether it's training or education, send them my way. You can call or text or email me. And then I've given you our two websites at the bottom. Forge has a Wisconsin-based website and then our national website. So thanks a lot for your time today. If you have any feedback or any questions, please reach out. I'll be happy to have a conversation with you. Go Pios. All right, thanks all.